Hello, Dr. Jeff Williams here with Creekstone in beautiful Amarillo, Texas. And I'm also your host for the Chiropractic Forward podcast that just got kicked up and rolling. Now, this week, we're going to talk about some attacks on our profession in the not so distant past. We'll talk about the current state of the opioid epidemic, and we'll talk about why right now is such a good time for what is going on with chiropractic research. Before we get to the meat of the subject this week, I want to say I hope you all had a Merry Christmas, Happy New Year, 2018. It's going to be a good one. I feel it. My family, we brought it in just sitting on the couch drinking some decaf coffee, so it was very uneventful but pleasant. I used to be a traveling musician in what seems like a former lifetime now, and if you'd have told me 10 years ago that I'd be bringing in the new year sitting on the couch drinking coffee, I would have laughed at you in a dismissive way and probably given you a look that would not have been taken as positive. But jobs and kids and family, they have a way of forcing the needed changes, and that's okay with me. It's all part of life, and better believe that I'm living it. So here's to wishing you all a happy and prosperous 2018. Now back to the topic. This is the place where we talk about some pretty cool stuff going on in the chiropractic field, and it's usually all based on research and evidence. So how cool is that when you can just sit back and let all the super smart guys and gals validate everything that you do? What a blessing these people are. Of course, we chiropractors have always known we were right about how to go about treating our patients. I mean, think about it. Think about the generations of attacks this profession has endured through the years from extremely powerful people in the legislative and in the healthcare world. The American Medical Association, I'm sure it doesn't get more powerful than that. Heck, they even lost an antitrust case in the Supreme Court when chiropractors sued them. In short, chiropractors proved in federal court that the American Medical Association did the following or encouraged their members in the following manner. They encouraged ethical complaints against doctors of chiropractic. Outstanding. They opposed chiropractic inroads into health insurance. Again, outstanding. I wish they would have won that one. Insurance is just quite a beast. If healthcare were just cash-based. Anyways, they didn't. The American Medical Association opposed chiropractic inroads into workmen's compensation. They opposed the chiropractic inroads into labor unions. They opposed chiropractic inroads into hospitals, and they attempted to contain chiropractic schools. They conducted nationwide conferences on chiropractic. They distributed publications critical of chiropractic, and they assisted others in preparation of anti-chiropractic literature. They warned medical doctors and their underlings that professional association between medical physicians and chiropractors was unethical. Anyways, they discouraged colleges, universities, and faculty from cooperating with chiropractic schools. If you hear all of this ridiculousness and you say to yourself, there's just no way that this is true, then please do us both a big favor and Google the term WILK, W-I-L-K, WILK versus AMA, and that should tell you all you need to know about the matter. It's quite a history. Anyway, to my original point, if we weren't right, we would have been destroyed years ago by the machine. Now listen to me here. I'm going to say it again. If we chiropractors were not right, we would have been wiped off the map years ago. It certainly wasn't from a lack of effort or from a lack of trying on the part of the powers that be in healthcare. The best part about the blogs and podcasts and videos I share every week is that most everything we talk about has its roots in research. And how do you generate facts exactly? Well, I'd argue that you generate facts through research. I hear it all the time. Doc, I tell my family I believe in chiropractics. Well, my response is pretty simple. We're not a church. You don't have to believe. We have mountains of research. The problem is, few people know about it. And those that do know about it, they don't seem particularly skilled, other than a handful of people, they don't seem particularly skilled in sharing the message. Mountains of research, after some time, begins to look a lot like facts, don't you think? And facts are pesky things. A person doesn't have to like them, they just are, like it or not. I don't like the fact that our national debt and deficit is what it is right now, but they're just facts, and we have to learn to live with it. Well, the medical field is starting to learn to live with some new facts. In fact, they're getting smacked down like a red-headed stepkid by these facts. And no offense to any red-headed stepkids, by the way. Facts like this: the opioid crisis cost the U.S. economy $504 billion in 2015, according to an article from Reuters this year. And the article was written by Lucia Mudakani and Ginger Gibson. The authors of this article were relaying information taken from the White House Council of Economic Advisors, also known as the CEA. There's no reason to expect this number to improve anytime soon either. If indicators are correct, as numbers become more available for 2016 and 2017, you're going to see this amount explode. The opioid crisis has reached the point that President Trump was forced to declare it a public health emergency. Big deal. The article goes on to discuss the fact that there was a total of $221 billion to $431 billion in lost economic output due to there being 33,000 opioid-related deaths in 2015. The wide range in dollar amounts there is to take into account the fact that there are several different models to count all this stuff up, but I think you get the idea. It's incredibly significant. The crisis has worsened, especially in terms of overdose deaths, which have doubled in the past 10 years, the CEA said. Wow. And if I'm correct, you can compare the crisis to a fire. While it may have taken 10 years to double, which is bad, I believe the rate of expansion of the problem has increased exponentially. The article wraps up by citing the U.S. Centers for Disease Control and Prevention as saying more than 100 Americans die daily from related overdoses. 100 a day. On top of that, new information is out that opioid-related deaths have now surpassed that of breast cancer deaths. Think about this. I love that the NFL does the pink uniforms during October, which is Breast Cancer Awareness Month. I love it, but I'm wondering if now we're going to start seeing a specific color designated and more awareness for the Opioid Addiction Awareness Month or something like that. I'm just saying it's really bad, y'all. How bad is it? Well, it's so bad that a recent article in The Guardian says that overall life expectancy in the U.S. has declined for the second year in a row as a result of the opioid crisis. Can you imagine? It's the first time in 50 years that the U.S. life expectancy has gone down for 2 years in a row. The last time that happened was the year of our Lord, 1963. The article in The Guardian was written by Jessica Glenza and was published on December 21st of 2017. In the article, she shares that there were 63,600 opioid-related deaths in 2016, which was an increase of 21% from 2015. These numbers came from the National Center for Health Statistics. As I hinted in the beginning of this blog, early indications for 2017 aren't looking very bright. Robert Anderson of the National Center for Health Statistics says of 2017, it doesn't look any better. Anderson goes on to say, we haven't seen more than 2 years in a row in declining life expectancy since the Spanish flu 100 years ago. That's what he said. We would be entering that sort of territory, which is extremely concerning. Also, what he said. So there are guesstimates that this crisis is going to take a good 10 to 20 years to turn around now that multiple generations are already hooked. Realizing that the first phase of the opioid crisis was started by physicians overprescribing these opioids, the American Medical Association and the American College of Physicians have really stepped up in a way that I would believe most alternative caregivers, such as me, would describe as pretty unexpected considering the history of these organizations and their behaviors towards alternative healthcare disciplines. They have consistently and constantly attacked, verbally, in the courts, and legislatively, just about any and all alternative healthcare protocols up to this point in history. However, in new recommendations put out in February of 2017, the American College of Physicians have now started recommending chiropractic, massage, and acupuncture as first-line treatment for acute and chronic low back pain before even taking an over-the-counter anti-inflammatory such as aspirin, Tylenol, or ibuprofen. Quickly thereafter, this article came out by the American College of Physicians, roughly about 2 months. The American Medical Association published an article in its journal, the journal called JAMA, or the Journal of the American Medical Association. They published this article in support of the updated recommendations made by the American College of Physicians. It took a national emergency of epic proportions, started in part by the medical profession itself, but now, finally, we have some realistic and responsible recommendations coming from the medical field on safe and conservative means of treating uncomplicated musculoskeletal conditions. I would say they need to go ahead and expand that to the entire musculoskeletal system, but acute and chronic low back pain is a good starting point, I suppose. In the end, it is my firm belief that patients are entitled to the best treatments that do the least harm. And there's nothing out there safer and more effective than chiropractic, massage, and or acupuncture. Through the years, I've carried with me a wonderful quote that I stumbled on by Dr. Lee Green, a professor of family medicine at the University of Michigan. He said, neck pain is a mechanical problem, and it makes sense that mechanical treatment works better than a chemical one. Now, doesn't it? Just another reason to call a chiropractor today. Research and clinical experience shows that in about 80% to 90% of headaches, neck, and back pain, in comparison to the traditional medical model, patients get good or excellent results with chiropractic. Chiropractic care is safe, more cost-effective, it decreases your chances of having surgery, and it reduces your chances of becoming disabled. We do this conservatively and non-surgically. In addition, we can do it with minimal time requirements and minimal hassle on the part of the patient. And if the patient develops a preventative mindset going forward, from initial recovery, we can likely keep it that way while raising the general overall level of health. Please feel free to leave a comment. Let me know your thoughts. I need to hear what you think. And remember, sharing is caring. Share, share, share. We can't make a difference without your help. Be sure to find us on social media sites like Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, and Instagram. Also, be sure to subscribe to our YouTube channel. The link is in the description, or hit the subscribe button below. That's pretty easy. At the very least, can we talk you into giving us a thumbs up on this video? A gesture that simple and quick really does help us get in front of more people that are looking for this exact kind of information. Be on the lookout for our new podcast called Chiropractic Forward. It's almost ready for public consumption, but in the meantime, you can get more research-related blogs at amarillochiropractor.com/blog. Till next time, thanks for watching. Tell someone you love. We'll see you next time.